All right. So, let's say that you have just graduated basic training. You are 68 whiskey and you're getting ready to go to AIT. So, what's next? First thing is you're going to have a very long bus ride to the Fort Sam Houston, Texas. And when you get there, there's several companies. There's Alpha Company, Bravo, Charlie, Delta, Echo, and Fox companies. Um, you can be put into a hold, which is if you get there before your battle buddies do. You'll just be doing, light work, paperwork stuff for the drill sergeants. But if you get there on time, with your company, you're going to immediately you're get shake down. So you're going to go to the PT field. You're going to empty your bags down on the ground. You're going to make sure you don't have any contraband. You're going to get assigned to a room. So these barracks, they're a lot nicer than the ones at basic training. They're more like dorm rooms, and you'll have like 3 to 2 people in there. A drill sergeants are going to assign your room a key. It's very important that you don't lose the key because they're expensive. And you're not all going to have a key. Sometimes it's just going to be one of you having the key. So you need to make sure that you're not running late because, one of your battle buddies wants to play sick or they have an appointment. So you want to make sure on time. So first thing, you're going to have these lectures. So they're boring lectures. You're going to take a class about how to study and how to highlight. After you take that class, you're going to get this big EMT book and a bunch of highlighters. Then like that, you get into a more exciting phase. There's 2 phases. First phase is the EMT phase. So that's like, first week you're there. So this is going to be when the Army prepares you to get your civilian EMT license. You're going to wake up in the morning time early. You're going to have PT, and you're going to straight to class. And you're going to be going to class from 8 to 5. You're going to learn your medical assessments, your trauma assessments, how to put your patient on a long spine board, how to do CPR, and other relevant EMT skills like you would in the civilian world. You're going to be doing your mods testing, you're to learn your all skills, and you're going to take your NREMT. So your mods. So that's a set of exams based on everything you've learned in your EMT phase so far. Your all skills phase is going to be your hands-on assessments, like your work on the dummy, like the whiteboard style skills. Then after that, you're going to take your NREMT National Registry EMT test, and you're going to have to do that before you go to whiskey phase. So during EMT phase, you will start off on phase 4. So phase 4, you get this black patch, it's got like Roman numeral 5 on it. You don't have any freedom. You're glued to your drill sergeants. They're always on your ass. You should get phase 4 plus, and it gives you the ability to get a haircut, but you do have to go with your battle buddy. If you don't have your battle buddy, drill sergeant's going to be all up on your business. So when you're going through this, you need to make sure you're doing good on your mods. Make sure you have a score of 75 or higher, and you can actually upgrade to phase 5. In phase 5, it's a patch, a Roman numeral 5, like a V on the patch. You get more freedom. You don't go to the same formations. You go to easier formations. You get liberty on the weekend, but you do have to go in your dress blues. And then you have your all skills. So if you fail 4 of your all skills in a row, you get recycled and you start over day 0. On your NREMT, there's 120 questions, and you take it until you pass. You renew it every 2 years. So you're taking it, and if you go from a really easy question to a really hard question, it means you're doing good. Don't be afraid. It's about 120 questions, but you can take more. You just take questions until you pass or until you fail. So if you don't pass your NREMT first time, it's okay. You have 3 more chances to pass it. So once EMT phase is over, you go to whiskey phase. And this is your 68 whiskey, your combat medic phase. You are going to learn care under fire and tactical field care. So care under fire, that's caring for a soldier in a mission. So if a soldier gets hurt, you're going to have to make sure that your battle buddies are pulling security. You have to get that soldier, you need to take them to a safe area, and you need to treat them. So care under fire, that's taking care of your patient when you have, bullets and ordnance going off and it's flying over your head, all that. You're not going to probably have full 360 security. But as long as you do have some security, you're going to be okay. You're going to grab that soldier, you're going to haul ass your patient, you're going to treat any life-threatening hemorrhages or amputated, injured limbs, you're going to take a tourniquet, put on there, and you're going to scream for your security, and you're going to get out of there. So you just remember, you're not always going to have a building, tent, truck, ambulance, a tank. You're not always going to have that. And you need to, be aware. I hope I don't have to explain this to you, but I will. The difference between concealment and cover. So concealment, bullets can go through concealment. You're just a little bit more hidden. Now cover, you can get behind that, and you're more safe from bullets, so bullets won't immediately pass through. Then you go to your tactical field care. This is when you're in a safer area, you're able to perform your procedures in depth, and you go through your procedures. So in whiskey phase, you're going to learn everything you need to know to take care of a wounded soldier, hopefully. You're going to be learning from sergeants, not drill sergeants. These sergeants are, medics that are hopefully very seasoned. So EMTs will be familiar with this. You have your airway, breathing, circulation. You're going to learn that when you're EMT phase. When you go to your whiskey phase, you're going to learn one more. You're going to have hemorrhage, airway, breathing, and circulation. So hemorrhage, it's actually the leading cause of death in the battlefield. If you don't have any blood, you're dead. So first thing you need to do is to treat, life-threatening bleeding before you do anything else. There's no reason to check an airway if you're bleeding to death. And once you bring that soldier back to tactical field care, you're going to do a secondary check for bleeding. You're going to do a blood sweep. And it's when you do a head-to-toe check for any bleeding that you didn't see, during care under fire. You're going to interlock, your hands. You're going to go behind your soldier's head, and you're going to go down, to the bottom of the toes. You need to make sure that there's no life-threatening bleeding that you didn't see in your first assessment. And if you do see any bleeding, you're going to expose the wound by, ripping and cutting that open, and you're going to patch it with gauze. You're going to treat that bleeding. You're going to secure it by wrapping it, and you're going to move on the airway. You have to make sure your soldier's airway is patent. Patent means that, air can freely come in from the lungs to, outside the body. So if your soldier or patient is screaming in pain, it's a good sign because they're breathing. Don't use a NPA or an OPA if they're screaming. You're going to get fucking hit. So if they're unresponsive, you need to check the airway. You can do the head tilt chin lift. If you have or suspect any cervical or spinal injury, you're going to use a C-draw, or you're going to use that jaw thrust maneuver. So you're going to be careful with your fingers so it doesn't get bitten. You're going to clear the mouth. You're going to open the mouth, clear it of any teeth, foreign objects. You can use an OPA. You can use an NPA, but you need to be careful. If there's any burns, facial trauma, like a broken nose, broken teeth, you can seriously injure them or hurt them even further by, killing them. Killing your soldier or your patient's not very good. After that, even if you don't see anything, you need to expose the chest. You need to make sure that they don't have any trauma like a GSW. If they do have a GSW, gunshot wound, you need to use the chest seal. This is learned in whiskey phase. So, most of the time you have a gunshot wound, you're going to have an exit wound. So you need to look for that. And you're going to look around, you're going to sweep for blood on their back and make sure they're not bleeding out the back either. You're going to make sure that the chest is rising and falling, making sure both sides are coming up and down equally. Now, if not, we're going to suspect probably a tension pneumothorax, hemothorax, some sort of collapsed lung. Now, how do we treat this in the field without any imaging? You're going to want to use a NCD, needle chest decompression, and that is a 14 gauge angiocath needle. And what we're going to do is we're going to put that between the second intercostal space on the mid-clavicular line. So it's going to be lateral to the nipple line, and you're going to put the catheter in laterally in relation to the nipple line, and try to stay out of that cardiac box because it has a lot of vessels in it. You can bleed out quickly. The reason that the NCD is so important is it alleviates pressure from a collapsed lung. So you're going to make sure, first off, your bleeding is secured, your airway is good, and you're going to check circulation. So what you're going to do is you're check both the radial pulses on the wrists, both of them. So if the pulse is absent, that's not a good sign. In training, you're going to scream, checking bilateral pulses. And don't use your thumbs, because your thumb has a pulse, and you're not going to be able to tell if it's your pulse or the patient's pulse. Now, let's talk about transporting the patient. You have your 9-line medical evacuation. So, whiskey phase, we only learn, the 5 ones. That's the ones we use most often. So you have your grid location, you give them your location, your call sign, who this is, like Medic 1. 3, you're going to tell them, it's urgent, surgical. 4th off, you're going to let them know what special equipment you need, like if you need a ventilator, if you need, hoist. And 5, you're going to say how many casualties. So if 1 casualty, it's Lima 1. 2 casualties, Lima 2, and so on and so forth. So after that's all done, you got them online. You're going to do your CCA paperwork, and that's your report. It's very important. It's long paperwork, long report, but it's okay. You'll get through it. So once your EMT and whiskey phase are done, the next step is Camp Bullis, Texas. So this is a lot easier. Like, you have the hard part. It's over. So you're going to go to this 2-week camp, and there's 2 phases. You're going to have your walking phase, which is when, these CCA whiskey sergeants, they're going to walk you through all these stages. And then you're going to have your running phases. It's going to be when you are expected to do these scenarios on your own. It's really fun. It's a rush. It's exciting. You're going to practice everything you learned. And at the end, you're going to have to do your CCA. And if you don't pass, you're going to be recycled back to whiskey phase, which is not fun. If you pass all that, you're going to get shipped off to your first unit. So, I hope you guys enjoyed this. I enjoyed making this video. Have any questions, comments, let me know. Next video, I'm thinking I might do it on the aid badge. Everything I packed in the aid badge and why we have it. So thank you for watching. I'll see you later.